Hi, my name is Miro Posvic, and I want to talk to you today about the placebo or nocebo effect. And you think, what is he talking about? So this isn't a herb or some kind of chemical. This is actually the importance of your mindset when it comes to your health and your attitude towards yourself. So this guy wrote a book, David Robson. The book is called The Expectation Effect. And what they talk about is they talk about the fact that a person's mindset and belief has a profound and significant effect on their health. Now, personally, I always thought it was like about 10% thing if you have a good attitude. But after reading his book and doing some more research on it, I've really kind of come to the understanding that it's probably like a 60% thing, that your mind really affects how you feel and how things happen. So let me kind of back it up for a second. So when they do drug trials, when they try different medications and stuff, they give people the actual drug, and they give them blank sugar pills, and they don't tell them which is which. And what's crazy is that people will get a ton of benefit from just the sugar pills based on their belief. In fact, in a clinical trial, if the actual drug is only 15% better than the effects that the sugar pills did, that's considered a successful drug trial. So that's really cool. So that's the placebo, where people are getting a benefit just from their belief and their state of mind, right? Another thing that's interesting is it goes the other way too. So for example, if they have a drug out there that's been out there for a long time, and say a small percentage of people, let's say 1% of people have nausea and vomiting from the drug. Now, once that news gets out there, millions of people are going to come back and say, hey, I got nausea and vomiting from this drug, because they're taking the drug, they saw the news report, and they're like, oh my God, I must have nausea and that. And a lot of that is really profoundly effective. And it's very interesting because they've done also studies on how doctors present information, and how certain doctors are more credible than other doctors, and how the patient outcomes will actually improve on doctors that communicate confidently to their patients, right? Which is just, it's such a profound thing. The reason I'm kind of introducing this topic to you is be very, very cognizant of where your mind's at, right? If you're diagnosed with an illness or something, and you fall into this rabbit hole of, oh my God, I got this, and I'm gonna have a compromised life, and I'll be crippled under this and that, and it's a really hard thing. Like it becomes their illness becomes part of their identity, becomes part of who they are, and it's such an important thing to not fall into that mindset. Like I've seen people like tattoo their illness on themselves, and I'm like, oh my God, that's such a negative thing to do. The words we use and how we present ourselves and express ourselves are so important. And it sounds like woo-woo, crystal wearing weirdo garbage, right? It's not. It is scientifically proven that your mindset and your expectation are probably one of the most powerful things that you can do in your overall health and wellness. And it's something you can control. And like I said, it's so easy when you have something, or diagnosis, and you freak out, oh my God, I have this, I have that. And I'm not saying don't treat it, and I'm not saying don't take it seriously, but really stop and think about it. I mean, the Mayo Clinic, one of the top hospitals in the world, really, they did autopsies on people that had died in their care. And they found that the actual diagnosis was not the cause of death. In fact, they found over half of the diagnosis that the patient was being treated in was completely wrong. So, again, best doctors in the world, all the best equipment, like access to the best of everything, and they're still wrong half the time. So if you get some crazy negative diagnosis, take a breath. Don't let it own you. Don't let it become part of your identity. Look around, get some more opinions on it. And if it is where you are, then you treat it the best way you can. But don't dwell on the negative of it. Don't dwell on the expectation that you're gonna have a compromised life, that you're not gonna have a positive experience anymore. It's so important to have that mindset. And we've all seen people that are, have had a very hard life and have significant disabilities and stuff, and they're still having this incredible life. And you have someone else that has one health problem, and it seems to like run their entire lives. So be very careful of your own mindset, how you speak about your illnesses, how you speak about your health, how you speak about yourself. I know for myself, I'm not 25 anymore, and I got into a rut where I was like, well, I'm in my 50s, and you think, oh my God, I'm old. I started feeling old, And I kind of got at it, saying, you know what, this is, you know, people are living to their mid 80s now. You know, I got 30 years left. I got I got to get off my butt, get working out. I lost a bunch of weight, and you got to have that really positive mindset. It will profoundly affect how your life goes every day, and it will profoundly affect your health, both in a negative or in a positive way, depending how you approach it. So that is my health thought for the day. I think it's really important that you really be aware of it, and I highly recommend you to pick up that book by David Robson. I think it's like $16 on Amazon. I think they have a Kindle version for like $3. Pick it up, read it, and you will be shocked. They have example after example of how people's physical health is profoundly affected by this kind of stuff. Thank you.